There it is.
Well, hello and welcome to another CARP session here using modern technology, Zoom in this case, and we have a special session this time around dealing with us old folks, which does not include our chair, Hugh Crizel. Hugh is going to be a senior eventually. As a matter of fact, anyone who's younger hopefully is going to become a senior eventually, because the alternative is not something we wish to contemplate. But we have, over the past summer, our guests have been dealing with older folks, and specifically those over the age of 80. But hopefully everybody's going to get to that age eventually as well too. So we have an esteemed professor from Laurentian University here in Sudbury, Dr. Parveen Nangia, who is a full professor in the sociology department. And I'll go over his credentials in just a moment. But also we have one of his students, Kelly Gingrich, who is joining us, actually goes to Laurentian, but is joining us this morning in this episode from Toronto. And of course, Hugh Crizel. Before I get into the actual introduction of Parveen and Kelly, Hugh, maybe a little bit of overview on CARP.
Absolutely. Thank you for inviting both our guests and myself to participate today. And we do distribute this both to CARP National and across the country, and it's available on YouTube to anyone who wants to listen. Now, John, I am an older adult in training. I've got training wheels as and you know, we do recognize that as time passes, we go through all the stages of childhood to adolescence to becoming perhaps a couple, a family, whatever arrangement socially, connectedly to our community and to friends. As we age, things happen, and I'm very glad that this research piece was done, because it identifies a number of key pieces of not just Sudbury and not just the North, but is very vital to understanding what is happening across our country. And I'll make a reference to something Daryl Bricker next talks about the future of our country using demographics. If you're interested, go to my podcast, Hugh Crizel, and just type Hugh Crizel in podcast and then look for Daryl Bricker down the list. Well, you can read his book next. John, it's time for you to introduce our guests.
Well, Parveen, Dr. Nangia is a doctorate and a full professor at Laurentian University, and recently was chair of the sociology department, multidisciplinary history and geography, all sociology, of course, demography, and several decades of research. He's going to be a senior as well, eventually, of course, and conducted much research in a number of different areas: migration, health, social inequality, discrimination, and well, it goes on, and we could spend the whole half hour here just going over his history and his resume. His students do appreciate his classes, and really dealing with, you know, the sociology area led into, or I mean, I guess you'd have to say led into this idea of examining to a degree us older folks, and in particular when Kelly was involved as your assistant, the research assistant, dealing with those of us over the age of 80, which is a growing segment of the demography here in the Sudbury area. Kelly, perhaps we can ask you, how did you get actually involved with Parveen on this particular subject area?
Well, actually, when I was in the fourth year of my undergraduate degree, Parveen was looking for an assistant, a research assistant, and a TA, and I was available. I was very grateful for the opportunity to get some research experience. And as I continued into the project, I got very invested and was luckily able to stay on and help him complete that work. You're much younger than the subjects you were dealing with.
was that any difficulty in relating to those of us, and I remember you interviewed me as well, and any difficulty in dealing with us more senior age?
I didn't find any difficulty either. I mean, everyone was very lovely, and everyone, you know, explained themselves very well. And no, I didn't find any difficulty. I don't think they found much difficulty relating to me either. They were all very good discussions, very good conversations during the interviews.
John, if you don't mind, I'll ask Parveen the next question. Parveen, in doing this kind of research, why is it important to understand what the needs are, what the aspirations are, what the fears are of older adults here in Sudbury and across Canada?
I think, you know, because it's a growing population and people are becoming more and more dependent in this age. So that's why we thought it's important for us to know what they are looking for, what kind of support they want from the government, from others, you know, from their family, from their friends, from our support system. So that was something which intrigued me into getting into this project. You know, WHO has been doing so much work on the quality of life of people, age-friendly communities, and you know, all the different countries, they are adopting those models, the recommendations of WHO. And in Canada also, we are adopting that. We are moving towards you know, age-friendly communities. And when we say about age-friendly communities, then basically, if we want people to stay at their home, we would like to know what they need, what kind of support they want, so that they can stay at home for a longer duration or as long as they can.
And being healthy, being able to move is incredibly important. So an age-friendly city has sidewalks that are cleared after a snowstorm, has a downtown that's accessible so you can visit if you need to, your financial planner or your bank or your any medical professionals. So an age-friendly city has to be friendly right at the foot level. Trip, slips, and falls, that was identified as one of the challenges for people.
That's
Exactly.
true. I know that we, one of our sister organizations here in Sudbury, Friendly to Seniors, which has a website, friendlytoseniors.ca, a number of years ago, the main emphasis on this for this organization was trying to determine just how friendly services and accommodations were for seniors. And there's been great advances over the last 20 years in organizations being able to recognize the special needs of seniors, and I don't like to use that word catering to, but indeed, I think I think our communities have been more friendly to seniors over these years. Parveen, would you agree that and Kelly, based on your research, that seniors feel more comfortable in their communities now?
Well, you see, the city of Greater Sudbury is also working in this direction to make Sudbury more age-friendly community. And they've had a number of sessions with the seniors. Now, the issue is, you know, most of the studies which have been conducted, and even the city of Greater Sudbury, when they look at seniors, it's all 65 plus. Or sometimes 60 plus. But, you know, we were more interested in knowing about the people who are 80 plus.
Yes.
And I would call them elderly persons, you know, because at that time, the needs are changing at a more rapid rate compared to when you are in 65 to say 79. So that's why we were more interested in this age group. And Kelly did a wonderful work in meeting different people and collecting information from them, talking to them, and finding out what their needs were and how they were, viewing themselves in this kind of new environment, and what kind of facilities the city is providing. And she came up with so many issues which seniors are concerned about, like some of those issues you have mentioned, like slippery roads. Walkways are not worth walking during winter. Parking lots, parking meters are not approachable. So,
And if they are, they're a little complicated to use. This is the report, Kelly. It says here the first draft. Does that mean that there's something else coming after this?
Yes, there is more coming. That's an initial draft, draft reporting our initial findings as more of an overview or an executive summary, if you will. We do have a couple of more in detailed papers in the works.
Now, Kelly, if you don't mind, I know that you approached many people, and I know that we tried to attract from our almost 1,600 households here in Northeastern Ontario, people to join this study. How many actually did? Because I'll face it, a lot of seniors share things with me, but then I'm just a conduit, but I want them to engage. And did they engage with you?
So initially we were looking for qualitative studies, interviews, obviously of much smaller samples than just a general survey. So we were looking initially for 30 participants. After a lot of trying, we ended up with 20. So we adjusted for that. The emails that CARP sent out actually were, we got quite a few of our 20 from you guys. Yeah, but I think one of the things, like you say, they have a lot to say. Seniors have a lot to say. And the people that I did interview, they were incredible. They provided so much useful information for us. One of the barriers that I think we ran into, something that some of our participants actually mentioned, was they're wary. They're wary of volunteer opportunities. They're wary of scammers, and rightfully. That's a big issue. That's something that we identified as well. So I think we did convenience sampling. We put up posters in various homes, in cafes, in libraries, public areas that seniors frequent. But that might be something that they're quite wary of. They don't want to call a number and sign up for something. So that in of itself is valuable information.
What about those who didn't respond but still have opinions worth collecting? Mm-hmm. Kelly and Parveen, you built something in, or maybe in a future report, you'll say, this represents, I mean, I know I read that, this represents a small cluster of people who are willing to share, but there are those who don't have the voice. How do we capture their needs?
Yeah, absolutely. Most of our respondents were not people from marginalized populations. So further studies would absolutely need to specifically be looking at the seniors from Indigenous populations, for example, and other racial minorities.
Francophone communities, absolutely. Other linguistic groups, yes. Mm-hmm.
Yeah, absolutely. So that's probably the biggest limitation of this project.
And what about perhaps seniors living with a younger, a child who's not a child anymore, who's maybe 60 years old? Mm-hmm. Was there an interlocutor between perhaps an elderly person and you?
For the interviews that I conducted, there wasn't, none of our participants had adult children living with them.
I know that there was some suggestion from some in our community that maybe interviews with those people who are in retirement homes or even in a nursing home settings, but they're in a different environment. They're not really in the community as a whole. Was that a consideration?
That was a consideration. We did approach I think all of the homes in the greater Sudbury area. We were able to put up posters, recruitment posters in some of them. Others, either denied that access or they had their own entire ethics process that our time frame didn't allow for. So we did put our posters up in some. So I don't know why seniors in those homes may not have been able to volunteer to participate, but that was absolutely a concern because, like you say, John, with them being not fully in the community, they're a little bit isolated and therefore have really unique needs that would also need to be addressed. So again, that's an area for further study.
I was just going to say, they're just talking about the isolation and those in nursing homes and in retirement homes are not quite as isolated because they do have other people there all the time. But there's also that segment of the population that, because of the pandemic, are more isolated than ever. They don't have that opportunity to get out with their friends and sometimes even their relatives. Was that a concern that was expressed somehow?
Well, COVID was not a situation at that time when we collected the data. Mm-hmm. So they were able to move around, they were able to go out and people could come and visit them. And we were very considerate and we wanted to include people from different segments of the society and people living in different kinds of retirement homes and even nursing homes. Nursing homes have their own problem, and we were not able to access any of those places. But in the retirement homes also, Kelly put up posters again and again, several times, inviting people. Once you put a poster, then maybe after a month, people forget about it. So she tried again after a month, and then again after a month, and still we were not getting any volunteers. And she has explained the kind of fear they have in mind about scammers and other kinds of things.
Parveen, if I may ask, you obviously are in contact with researchers across the total Canadian content and perhaps around the world, I would imagine, through symposia and conferences. This research, is it being conducted in other cities across Canada? Because, I mean, there's going to be a collective Canadian experience, but are there northern experiences and western experiences, eastern experiences that are common?
Well, there is one study being conducted in Canada that is called the longitudinal study of aging. And they are collecting data from all over the country, and similarly there are other places also where these kinds of studies are being conducted, especially where the aging population is higher in proportion.
Like Atlantic Canada.
Yeah, Atlantic Canada. Yes. So
yes.
The data are being collected. And then there are some other sources also, like, Canadian Community Health Survey, General Social Survey, which sometimes collects, they have a special module for collecting additional information on a particular group. And sometimes, the kind of data they collect, it can be used for the seniors population also. Mm-hmm. So in some of my other studies, I have used secondary data from Canadian Community Health Survey about the mental health of seniors, or and in that the
and I'm sure
population is also.
And I'm sure even StatsCan data. I mean, if you look at CMA's Census Metropolitan Areas, there's going to be lots of rich information. Kelly, and maybe a good time, if somebody wanted to read your study, not if, when they want to read your study, is there a link on the web that people, say in Toronto or Sackville or Wolfville, Nova Scotia, can actually go online and read your study? Is there a link that you could share?
So right now we are still in the process of writing. They will be forthcoming this year. Okay. So they will be published sometime this year.
I'm sure John will distribute that for you.
Yeah, absolutely. I'm sure we could forward a way to access that.
John,
Kelly,
you must have more
I
questions.
was thinking, Kelly and Parveen, if it's possible, as you know, Sudbury has the highest percentage of seniors of any large community here in Ontario. But is it possible just to briefly summarize the findings to
Please.
date for those that you did survey?
Yeah, we can try to do that briefly.
Yeah.
Go ahead. So first of all, housing. Housing was a big thing, affordable housing. Our participants had a lot to say on that, particularly the lack of it in the greater Sudbury area. And retirement homes as well. As you know, they're very expensive. Seniors are wanting to put off going into retirement homes as long as possible. So our findings confirmed that. And another thing in terms of specifically when it comes to Sudbury and housing, they talked a lot about housing opportunities for the city to buy buildings or construct senior housing. Those opportunities tend to fall through. That was a concern. When it comes to health, it seems that basic needs seem to be being met in terms of healthcare. There's enough healthcare services. The participants that we had were fortunate enough to all have comprehensive insurance. So they tended to be okay when it comes to accessing health services. However, the health system, they had some concerns about in terms of the bureaucratization of it and the privatization of some of it. And they tended to switch then from general practitioners to nurse practitioners because they had more time to actually listen to their needs. That was across the board something that they opted for. When it comes to social life, friends, of course, a lot of them had informal social groups that they met on a regular basis, similar with family. They mostly had family in town. However, there did seem to be a lack of enough options for social activities. Again, there seemed to be enough basic necessities and like the medical services available, but there was a lack of social. So there seemed to be this perception that in Sudbury, seniors kind of just need their medical services covered, right? And that social interaction wasn't as much of a priority in terms of city and government programs. So there was a need for more of that. Accessibility, again, physical accessibility. We've talked a little bit about that in terms of walkability. The city is working on that. So physical accessibility seemed to be okay across the board. But again, accessibility in terms of social inclusion, there needed to be more done about barriers socially. So like we talked about with downtown, it's not inviting for seniors, both from a safety and a logistics standpoint. A lot of activities that they wanted to go to were in the evenings, and a lot of them do not drive in the evenings. That was an issue. That's a barrier. Volunteering, a lot of them do we have time? We have a 10-minute timer going.
We're good. We're good.
Keep going? Okay. So in terms of volunteering, informal volunteering seemed to be a big activity for this age group. Whereas again, if we were looking at the 60 plus, there would be more formal volunteering in that, but now it's informal volunteering, which is taking care of friends and family, those who still drove their friends to and from places, to appointments, things like that, helping out at churches. So very informal volunteering, which is important to bring up because informal volunteering doesn't necessarily get included. It's kind of an invisible, it's invisible labor in many cases. They're doing work, they're taking care of people, but that's not seen or recognized. So I think that's important to recognize that they are doing quite a lot of that. we asked about various activities, how they spend their time, solitary activities versus group activities. Again, a lot of them were part of informal groups that would meet as, you know, a church group, or as a walking group or an exercise group, things like that. These participants didn't do too much in terms of formally organized activities, like through the YMCA or anything like that. So that's a point of interest. Let's see.
There's so many things going on, and it's really hard. I'm glad you mentioned the informal piece of it. But I will tell you, for many that I speak to, their closest companion is the television. And did people speak about that?
They did. So in terms of entertainment was our category. Watching the news seemed to be a favorite pastime for many, especially those who lived alone. So they did talk about, yeah, they spend a lot of time watching TV, watching various programs, mostly the news. At this time, of course, this was a little while ago that the interviews were being conducted. So a lot of them were getting their entertainment from watching American politics, for example. That's become an point of entertainment. So make of that what you will.
And everyone is not internet savvy, you know, particularly in this age group. There are some people who had never moved with technology, never learned that technology, and you know, it's difficult for them to keep pace with it now. And I think one of the interesting things which Kelly came across was the affordable housing. You know, that is something which we lack here in Sudbury, and the group which we interviewed, they're comparatively better off. Yes. But you know, there are many people who don't have those kinds of financial resources, and for them, affordable housing is a big question. They cannot modify their house according to their changing needs.
Right.
So there could be some kind of you know, subsidies from government to help them to you know, modify.
And there are many subsidies out there, Parveen. It's a question of having somebody be their advocate to show them that they can make this application and follow the application. And maybe even construction companies who say, if you want me to put a rail up between your bathroom and the bedroom, I can build that for you. I can install it, and you can find some funding for that. But again, it's having the knowledge and having people who are aware, who will be your voice. John, exactly. We're approaching the end of our time, though. We do see that clock ticking.
Yeah, and I know that perhaps we could ask Dr. Nangia what and also Kelly, what can we expect next?
That's a good question.
Yeah, we would like to you know, extend this study and get more people into you know, get more interviews from people from different segments of the elderly population. Now, again, we need resources for that. You know, whatever budget we had for the study, we have exhausted almost all of it. And also we need cooperation from people. You know, if despite repeated efforts to recruit them, if they don't join, then you know, there should be some other way. I don't know if to what extent CARP can help us in recruiting people.
We'll do our best.
Yes.
But Kelly, it's tough. You've identified a really key piece of this is getting that collaboration. Truly, I'll use that word, collaboration. They got, everybody who participated got a copy of your first draft to say, yes, I heard you, we've incorporated your ideas. Maybe even that can be a real handshake for them to reach out to their friends and say, look, I participated in this and here's the results, and I would like you to engage with us as well.
Absolutely. I like that you used the term collaboration there, because that's why we did interviews instead of surveys. We want research to be, helping give them a voice, right? And help them feel more empowered to be able to reach out to access these things, these services, or subsidies for housing, like we said. More, and I think that's, and that's going to be even more important now, making those connections of just social relationships and empowerment, and allowing them to participate more as citizens, as senior citizens in our democracy. And
but you had a real outlier there. I mean, John's not 80. He's not part of your survey group.
Well, I wish that were the case, definitely. But I think we've run out of time. And but once this pandemic ends, we hope that we'll have the opportunity to meet in person, and perhaps at one of our meetings, and to get some real feedback from individuals who are present. So, as I said, we're all hoping for that in the well, we also hope in the near future as well too. We want to thank Kelly for you being with us. Parveen, also, this is wonderful to have this opportunity, and we thank you for doing this study, because the more information we have, the more able we are to do more good for our senior population in the area, which constantly is growing. So thank you very much.
Absolutely. I want to applaud your efforts as well. The knowledge that you share builds resilience in our community. On the behalf of CARP here in Sudbury and CARP across Canada, I thank you for doing your research, both Kelly and Parveen, and for sharing it with us here on this channel.
thank you for
Thank
the
you very
opportunity.
much. Yes, thanks for giving this opportunity. And we are really glad that we were able to share our study findings with all of you.
Very
Those
good.
who are listening. Yes.
Stay safe.
Thanks, John.
Keep well. Bye for
Thank
now.
you.
You too.
Thank you
Thank
again.
you.
Bye.
Folks.
Bye.
Bye.